Hi everybody, I'm Christine Sutherland. This is Bev McClinchy. We are where, Bev? What town? Nelson, BC. And we got a lot of noise going on in the room, but we're just going to keep going. So, unless we get like drowned out by the noise. Okay, this is the excitement that we're going to do today. Yay! We're going to be icing Bev's wonderful incision site. So we're going to do that first, and then we're going to show you also how to work around the ileostomy. We got that right, got that pronunciation right, so that you aren't intimidated about your tummy massages. You know how to navigate around pouches, and also you just had a drain out on your side here. So it's not quite as exciting as we would like, but Bev's just fine with that. So you know, Bev, before I think I get to this, we'll do something nice for you. We'll do the massage.
Okay.
That'll make you feel good. So be sure and warm up your hands, especially if they've just been holding ice like I was doing. And then we're just going to unveil your tummy, and we're going to be able to massage around Bev's pouch, so that I'm going to give you a little anatomy lesson here, Bev. So the small intestine in the middle hooks up to the large right in this corner. It's where people know their appendix are, and they often get their appendix out. And then we're going to massage up the ascending colon. Then we're going to hit this corner right below your ribs here, and that corner is called a flexure. And then we're going to come this way, and we're going to go along, and you can see where the edge is for Bev's pouch. And then this is also the end of her incision line, which is still needing some dressing. We just glide over that. So that is pretty good, eh? We've got a bit of an obstacle course we can teach. And then you might want to come, look at that breast draping, right? And you might want to come, so this was where Bev's drain was. And what were they draining, Bev?
Top of the liver.
Top of the liver?
Yeah.
Okay, so this was coming down, and then these little ones, what were they for?
Oh, goodness only knows.
Okay, they're in the goodness only knows department here, but we're just going to go gliding along those, because mostly what we want to show you is how you don't have to leave out the abdominal massage. When you're treating somebody with a full body massage, you can include the tummy, and especially when you have people in post-surgical. And I'll show you here, Wyatt, we've got an incision line that runs from this dressing all the way down to this dressing, and it's got a bit of a curve. It's got the mountain highway idea here, but we're going to be able to massage along. We're going to hop right over that dressing, and this is where the bladder is. We can always lift up the bottom of a pouch and then glide along and then start massaging in this corner again. So don't be afraid also to handle the pouch. It's firmly attached. You won't be pulling at it or anything like that, but you want to be able to maneuver around it and not leave out this nice big chunk of full body massage. And again, when someone is post-surgical, often they have trouble with constipation, and it's down the descending colon. So remember, everyone, we start here with the large intestine, up the ascending. What do you think the across one would be called?
I have no idea.
Transverse.
Oh,
Now
okay.
you know how all the cute labels for yours. Transverse, transverse. Then what was this one? It's the quiz, Bev. So if we're going down, what would you call this one? Ascending.
Descending
You
colon.
got it. You were a good teacher. So we're going down the descending, but it gets more exciting than that. I do this running vibration. And did you have any constipation?
No, because I've had this in.
So that is kind of like the dumb question to ask somebody when they have an ileostomy. So this is Bev's large intestine. Basically, this is especially the descending colon, and it's where it goes from the front of the person to the back door. So it turns around, so all of this part's on the front. Do you know at what stage they hooked it up? Was it over in the corner?
That was when I was still up in the OR, I believe, the second time. I think I woke up with it. If you can call it waking up.
And now are you ready for us to do the incision site?
Sure.
So as much as we go with this kind of thing, the most important, I think, theme for this film clip is knowing that just because Bev has an
Ileostomy.
thank you. You'd never believe that I teach this, ileostomy, which means she's got all of her bowel contents right here. We still do the massage for her tummy in the traditional way, gliding across the bladder here and starting up the ascending along the transverse. Remembering that underneath here, there's a major renovation that's gone on. And here is where a lot of the work was done, coming in right here. So what we do when we're massaging along an incision site is it's always in towards the site. So for instance, this part up here, we would do this kind of movement, little teeny weeny movements that are gathering the skin, and the pressure is towards the incision site. The overlap here of the stoma attachment, you know, gets in the way there, but we can still do little tiny ones. So Wyatt, you can come really close on this too, and you can see that I can put one finger on top of the other like that, or I could do a single finger. Is that comfortable, Bev? And often patients are busy doing this themselves, so you can do, and if you feel along there, Bev, with your fingertips, yeah, you can feel how the adhesions underneath are thickened, and you can just work away on them. And not only are we going to work away, and we're going to see how that's dry there, where she has her umbilicus, we're just going to get some of the coconut oil there too. So the more supple that incision site is, the better it heals. Okay, but here comes the exciting stuff. So we're going to teach you today about ice massage. Now this is a really good example. You want to get something that holds the ice nicely and doesn't slip. And these are very absorbent, so they've got a good catch. But you could also use the kitchen tea towel. You could also use another face cloth. Face cloths are nice and thick now. But I'm going to put this around you, Bev, so that in case there's any drips, we've got a good catch. But my goal is to catch the drips as they happen. So I look for an edge here, and I try and get this edge because it'll make the least contact with you. I don't want to put the big flat side of the cube on you right away because you aren't used to the cold. So I'm just going to take a little teeny weeny. It's kind of like doing it with my fingertip. And I've got the edge of that, and I'm coming down. Oh, just about missed that one. I think I got it. So you are making melting fast. There we go. So I'll show you why those drips, so that she has a very warm tummy. We're going along and we're catching the drip. Not catching those drips as well with this one. So I'm moving on to this one and to see how I can catch the drips. So I'm used to using a longer towel which comes like this, and that way I can make sure that I'm not going to miss a drip. So right up here, I'll work along on the edge and wipe. So massage with the ice and wipe. And how's the temperature, Bev?
Fine.
Okay. Then I'm going to graduate. With your permission, let's go for something more edge.
Sure.
Less edge, more flat, more cold coming at you. So far, so good?
Mm-hmm.
Okay. So what I've got there, you can see why it is a flat end. And now, let's go for the most broad surface. You ready for this?
Mm-hmm.
Okay. So we're going with this ice. Is that tolerable?
Oh, absolutely. It doesn't even feel cold.
Okay. Let's see. And also what Bev is alluding to is that you have a diminished sensation here, because when there's been an interruption like this, often the nerve endings are cut. So, yeah, so you want to scratch it. You want to use textures like back of your hand is soft, hot and cold, because the skin has about 5 different cells that register texture, they register temperature, and they also register pressure. So that you can do firm and you can do light and all of those get those cells woken up. So wherever you have numbness, just try and give it a little exercise. There we go. Okay, and I'm going to give you a quiz. Are you ready? Okay, I'm going to give Bev the quiz, which is what I do when I'm teaching families. So we could get everyone from your daughter to Brent in here, and he's a plumber, so we could really teach him.
I don't think he
plumbing
would be
techniques.
too interested in coming into this somehow.
But your daughter's a whiz at massaging, so
Yes.
you never know. Okay, so if I'm coming up this side, what would you say the name of that colon would be? Starts with an A. Ascending.
Ascending colon,
Very good. And then the T one
transverse,
and the D one?
descending.
Give me 5. Okay, so what we're going to do is just make sure that you know that you can massage around a stoma site without disturbing it. And you can lift. The most important thing is that you can lift the bag. If it was plumb full and looking like a balloon, well, then you wouldn't be lifting it, but you could still sneak underneath it, because all of this area is for Bev to claim back again. She's had a tummy interruptus, and all of this light stroking is really good too. And then you can do things like you can feel it on this side. Can you feel it on that side? Good, great. And then the scratchies, can you feel those? Both sides the same? Good. Yay. So that is the Kootenai experience of getting your tummy rubbed the right way
Great.
early in the morning. So thank you very much for helping me teach that, because the more people can do it for themselves, but that their families can do that, the faster things heal up. And for some people, it's hard for them even to touch their
I know,
stoma.
I
You know,
know.
it's like, I didn't want this. What's it doing there? And especially because it's on the outside of you. Sometimes the indwelling ones, they're easy because you can't see them, but this is a hand-to-hand experience. Is there anything that you'd like to add?
I don't think so, no.
Okay, great.
No. I know Leslie Kitchen Jordan in the Cusp, who does acupuncture. She taught me this, to get things moving.
Great.
Yeah.
Okay, so you already were on the inside.
Well, it's a case of doing it and remembering it. There's
Yeah.
been so much information coming from everywhere.
But okay, I'm going to give you a quiz. I'm going to phone and go, okay, did you do your tummy? And the most important things are the connection here, and being able to feel around
Okay.
and see what's going on underneath there.
Okay.
But I'll pester you about your self-massage.
Okay.
Okay, it's a deal.
Good.
Thank you.
Thank you.